Hello, my name is Dr. Greg Simcoe, and can you actually do something about Parkinson's disease without drugs, without surgery, without dramatic medical intervention? Well, yes, you can do something about it. You can't get rid of it, but you can actually help with some of the symptoms and some of the degradation and degeneration that occurs as you age with Parkinson's disease. Well, Parkinson's is basically the lack of a neurotransmitter called dopamine. Dopamine is made in a part of the brain stem, which is called the mesencephalon, and part of the mesencephalon is something called the substantia nigra. That is where dopamine is made, and that is actually one of the key areas that are affected by Parkinson's disease. Now, Parkinson's is a mystery to a lot of individuals and practitioners, but there are some very interesting aspects to the metabolic aspect or metabolic side of Parkinson's disease. One is that there is a connection between autoimmunity and Parkinson's disease. Now, when I say autoimmunity, what I mean is that your immune system has developed antibodies, in other words, has developed a dislike of your own dopamine, which is actually kind of interesting. Your own dopamine is attacked by your immune system, which reduces the amount you have that actually helps to mitigate the shakiness, the shuffleness, and stuff like that. Now, where dopamine is made is in the substantia nigra. So as you see, if there is an autoimmune problem, okay, with your Parkinson's, that it should be addressed. Your dopamine is getting basically killed or destroyed, and you're not being able to utilize it by your brain in order for you to function normally. The other aspect of Parkinson's is that iron is very important in the development of dopamine. So if you don't have enough iron in your system, if you are anemic, in other words, there's not enough iron being absorbed by your body, then that actually can have an impact on the dopamine levels, which can actually affect your Parkinson's in a negative way. So I just mentioned two aspects of Parkinson's disease that you may not have known, and two aspects that can be looked into to actually affect your Parkinson's in a positive way. One way is for autoimmune situation is to reduce the amount of inflammatory foods you eat. One really big culprit in that is actually gluten, which is found in wheat, barley, and rye products. Pasta, bread, things like that. It has been shown, and this is not necessarily researched in the traditional way, but through anecdotal, in other words, people say, I've done this and I've actually felt better. They've actually eliminated these products from their diet and have noticed an improvement in their Parkinson's symptoms. Another aspect is to determine if you are anemic. If you're anemic, that needs to be addressed so that dopamine can be made properly with the iron that you're obviously not getting. So there's two things that you can actually do without surgery, drugs, or what have you to help your Parkinson's symptoms and reduce the degeneration that is occurring in your life. Parkinson's doesn't necessarily have to be something that you have to suffer with for long term. You can do things yourself to actually help. And if you can't do these things, you need to find a physician that knows what this is all about and how to deal with it. With nothing else to say today, thank you very much for listening and have a great day.